In my world, especially as a Yoruba man, I believe Agbo works. Agbo really works when it comes to back pain.
Sir, when you talk about Agbo, question is what is Agbo?
Agbo is traditional medicine. Back of tree, you cut grasses, leaves, put it together, blend, eat for 2 minutes, and you're good. Agbo really works.
It cures anything, everything. In fact,
no, that you are just assuming that something you use something and it works doesn't mean that it is actually the right treatment. So whenever you have
two persons supporting Agbo really shows it works.
It doesn't mean, even if you are 1 million, it doesn't mean what you're saying is right. If someone has back pain, the person needs to see a medical doctor.
I don't believe. My mom suffered from chronic back pain at a point in time.
Sir, you need to, because we need to understand what the cause of the
All
back pain is.
she needed to do was to see a traditional specialist who puts grasses back of tree, which we cut by ourselves.
No, sir. Now
they're very medicinal.
No, well, medicinal, that's what they made you believe, right? I'm not trying to, say that people don't use these things and sometimes they work for them. But that doesn't mean that it has addressed the cause of their pain. And that's what we're talking about.
But
that
for years, it hasn't returned.
It's not that people use that, but people who also massage the neck and massage the back and think that by doing that, they get relief. Those things can even, worsen their condition. So that's why we advise that they go see a doctor, for their treatment.
Me too.
Good day, everyone. Welcome to the second podcast edition of Health Conversation with Dukes. It promises to be another interesting section on today's podcast. My name is Ayorinde Babafemi Babalola, and I'll be one of your hosts today. With me is my co-host,
Oji Oninye Happiness. And here with us we have Dr. Ifeanyi Iwuagwu.
Thank you very much. My name is Ifeanyi Iwuagwu. I'm a consultant neurosurgeon. I work with Duke's Neurosurgery and Specialist Hospital. Thank you.
Thank you very much. On today's second edition, the topic we'll be having today to discuss is back pain, what you need to know generally about back pain. Sit down, relax, and enjoy the moment with us.
Okay. So, could you briefly tell us what is back pain?
Oh, thank you so much. Back pain, it's a sensation, an unpleasant sensation that emanates from the back. And this unpleasant sensation, it's due to an actual or potential injury to the back. So the part of the body we call the back is the part of the body that spans from just below the neck. That's from the junction of the neck to the pelvis. So that region of the body behind the trunk is what we call the back anatomically. So whenever there's an unpleasant feeling or sensation from that region of the body, that's what we call back pain. And like I said, it can either be as a result of an actual or a potential injury. Yeah, thank you.
Okay. Thank you very much, Dr. Ifeanyi. In your many years of practice, know that about that, how common is back pain in Nigeria? Is it a very common thing you come up with in your consultation room?
Yes, back pain is common in Nigeria. Even globally, it's actually common. It's been reported in 2021, there was a report that about 628 million people have back pain. And in fact, this figure has been projected to increase to 843 million by the year 2050.
Wow.
The prevalence of back pain as at 2021 was about 7,000 plus in 100,000 population. That means that 7 out of 100 people, will have back pain. So it's common in Nigeria, and it's usually common among people in the 50th decade. What I mean people in 50 to 60 years. So it's common in that range, and it's also commoner among females. And the likely reason for this is because of the way the back of the female is contoured. Okay, so they tend to have anatomical, contour of the spine
of the
female back compared to the male back. So back pain tends to be commoner, and back pain tends to be more common in females compared to males. So it's quite a common condition, not just in Nigeria but in the world.
Oh,
Thank you.
okay, Dr. Ifeanyi.
Yeah.
Could you at least tell us there should be signs and symptoms, right? For back pain, or rather early signs and symptoms. So what are some features one may experience that may make he or she like say, oh, I'm about to have a back pain? I'm having
Thank you
one.
very much. Okay, back pain itself is a symptom, right?
Okay.
But then there are other symptoms that may accompany back pain. And these include a weakness in the leg of the person. So if the person may actually have back pain and have weakness in the leg person, the back pain may actually be moving down as if it's a shooting pain, to the back of the leg of the person. Apart from weakness, other symptoms will include like loss of sensation, you know, in any part of the leg, maybe the foot, the
The
leg,
fruit.
the thigh. There may be loss of sensation. That's what called numbness. There may be reduction in sensation.
Okay.
Sometimes people report this pain prick sensation, which in the local parlance they call baja baja. So that's also another symptom that people back can also come with. Then the other symptoms that they may have include loss of sphincteric function. We mean that they don't have control of their bladder and the rectum, so they don't have control. So there's a loss of sphincteric function. Another symptom they may have is what we call loss of sensation in the upper part of the inner part of their thighs. Now,
Okay.
all these symptoms, can come with back pain. But when a person, notices these symptoms, it is very important that they seek the attention of a medical doctor. And in fact, a specialist like a neurosurgeon, okay, or a neurologist who would then listen to them, examine them, and then request for appropriate investigation, to help in their treatment. So this is what we call red flag signs. When the person notices all this, these are red flag signs with respect to back pain. Or even when a person has back pain and suddenly there is, an increase in the intensity of the pain, or someone has back pain and suddenly notices that, oh, it has an erectile dysfunction. All these are pointers to something sinister. And anyone who has back pain and is having these associated symptoms, need the attention of a neurosurgeon or a neurologist. Okay, so it's not just back pain, because sometimes back pain may not but there's some back pain that one will have and they will resolve after a few days to maybe
Later.
weeks. Yeah, we call it acute pain, and it can either be as a result of pain from the muscles of the back, what we call maybe due to spasm of the muscles in the back, or due to an inflammation of the joints of the back, or even the skin. All those things can also cause back pain. If it gets beyond 4 weeks, it's called subacute. Usually 4 to 12 weeks, subacute pain, and if it's beyond 12 weeks, it becomes chronic pain. So, but the important thing is that when you notice all the red flag signs I talked about earlier, please don't wait. Go and see a doctor. And when you say doctor, the doctor would have to refer you to a specialist, like
Okay.
a neurosurgeon or a neurologist, who would then see you, evaluate you, and then request for some investigations to help your treatment. Thank you.
Thank you very
Thank
much,
you.
Dr. Wagu.
Yeah.
I haven't talked about the causes of back pains, some of the risk factors of back pains. That will lead me to ask, how much does lifestyle, take for instance, sitting habits, like ergonomics in workplace, bad mattresses, especially for a place like Nigeria, whereby we don't take cognizance of mattresses that we buy, we only buy by sizes because of the volume of the numbers of people that will sleep on it. So how does lifestyle, I've given an example of ergonomics as working place, lifestyle choices of mattresses, how does this contribute to back pain, be it acute or chronic back pain?
Okay, thank you so much for that question. I would like to address that question by, talking about the causes of back pain. So we can actually, group the causes of back pain into two, what we call traumatic back pain, that is following a trauma to the back, or non-traumatic back pain, that is, other causes that are non-traumatic. Now, of course, like I said, when someone has an injury, like if someone is involved in a road traffic accident and you have back pain, you must see a doctor. Please don't take it lightly. Now, coming to the non-traumatic back pain, there are a lot of causes. And what you just talked about is what we call postural causes,
Okay.
and it has to do with the way you sit, or the way you lie, or the materials in your houses that you use for comfort. For instance, like you talked about the mattress. Some mattresses, the way they are built, they don't tend to support the natural curvature of the back. Okay, so in that sense, when you lie on them for a very long time, they tend to put strain on the muscles of the back, and that can then cause, pain, to the person. But it's not just about the sleeping mattress. Even sitting position. So when you sit and then you are curving your back, okay, you're not sitting comfortably like I'm sitting right now. You are going to, after several hours, you're going to put strain on the muscles of the back, and that will cause you back pain. And the simple reason is that the muscles of the back, they are doing a lot of work trying to, support your back in that position you've assumed. So because of that, work they're doing over several hours, they will they would, they'll be strained, and then that strain is what eventually leads to the back pain. Now, having said that, there are other non-traumatic causes which are also common among, the aging population, in Nigeria, and that's what's called degenerative causes.
Okay.
And examples include people who have lumbar canal stenosis, and we call them spondylotic, or generally spondylosis, but there are a couple of things under that very word, and one of it is lumbar canal stenosis. It simply means that, the canal, the space where the nerves from the spinal cord are actually sitting, is narrowed, and because of that narrowing, it tends to compress on the nerves coming from the spinal cord, and that can cause, pain, in the back. Um, Disc degeneration. People who have disc degeneration, it can be a disc bulge or herniation, or even a sequestration. They can also have back pain, because when these discs, herniate, they also tend to compress those nerves. They narrow the space and compress the nerve. Um, there's also inflammatory causes, like arthritis. People can have arthritis of the joints in the back, and that can also cause back pain. Infective causes like tuberculosis. Patients who have tuberculosis, tuberculosis don't only affect the lungs; it affects
I
other
was
parts
coming
of the
to that.
body. So when it affects the bones of the back, it destroys them, right? And then it will then affect the framework of the spine, which of course, lead to strain of the back and cause pain. Apart from the infective causes, we also have, other causes such as work associated back pain, what you want to call, hazard, work hazard. Sometimes people who are involved in a particular type of work, may have pain as a result of their work. And I'll give you an example. People who are involved in lifting heavy
Heavy
loads,
loads.
Okay, when you lift heavy load, you also put your back under strain, and that can cause, back pain. People who are involved in contact sports, they jump up, they fall, they hit their back on the ground. All these are repetitive trauma. Over time, they can also have back pain. Another non-traumatic cause of back pain is people who have what we call metastatic lesions, basically what we call cancers, right?
Yeah.
But then they have moved from their original position to
So,
the back. Examples are people who have prostate cancer, or people,
okay.
who have large bowel, like the colonic cancer. Even in women that have breast cancer or people have kidney cancers, all these can all move to the back. What you call metastasis, and then they can also have back pain. Finally, on this very non-traumatic cause, I want to also mention that sometimes people who have people who have had maybe a procedure before in their back. People have had procedure in their back, whatever procedure, whether it's a surgical intervention or not, can also have pain as a result of that procedure, especially when there is a change in the mechanics of the adjacent segments of the spine. Sometimes they can also have back pain. So there's a lot of non-traumatic, there's a lot of causes, whether traumatic or non-traumatic, but all these can cause back pain. But the important thing is that when you notice them, it's important you seek medical attention. Thank you.
Okay, sorry to take you back a little,
No worries,
Dr.
yeah.
Ifeanyi.
Yeah.
Could you elaborate more? Because when you were talking earlier, you made mention of acute and subacute pain, back pain. Could you elaborate a little more on acute, subacute, and chronic back pain in terms of duration, causes, and management?
All right, thank you. Now, like I said earlier, acute back pain means pain occurring anytime from 0 to 4 weeks. That is less than 4 weeks.
Okay.
Now, when it goes beyond 4 weeks, it becomes subacute. So 4 to 12 weeks is subacute pain, and pain lasting beyond 12 weeks is chronic pain. So basically, for the acute pain, it's as a result of an actual injury. It's a result of an injury that one has developed recently. For example, let me give an instance. So if a person is involved in a road traffic accident and then sustains a fracture of the vertebra, the person is going to have pain. That's an acute pain. So whatever causes pain to a person, at that point, it is acute, okay? But once the pain then lasts beyond 4 weeks,
Okay.
it becomes subacute. And of course, there could be reasons why pains will last for a very long time, especially when it's a metastatic cause or an inflammatory cause like arthritis. Okay. I even mentioned earlier, sometimes people have osteoporosis, which is demineralization of the bone, which occurs commonly in women, elderly women. It can also cause pain. So all these will cause pain, and most times they tend to cause pain that's lasting beyond 4 weeks. So and of course that will be subacute, and if it's beyond 12, it's chronic pain. Even the degenerative causes of pain, they tend to cause pain that lasts for several weeks. So, but at the point where this pain starts, okay, it's said to be acute, right? And then by the time it lasts beyond 4 weeks, then it's no more acute. It's either subacute, or if it lasts beyond 12 weeks, is chronic. So what I'm trying to say is that whatever causes pain, it usually will start from the acute phase and then progress to the subacute and then chronic phase.
Chronic phase.
Yes, but the treatment for this pain begins with seeing a medical doctor, a specialist, for example, a neurosurgeon or a neurologist, who would ask you some questions, will listen to your story, and then after that will then examine you as a whole, and then will then make what you call the clinical diagnosis. Clinical diagnosis means that based on the story you have told and the findings on physical examination, the specialist then decides that this is the cause of the pain and this is where the problem is in your back. So after that diagnosis has been made, the next thing is to then investigate you. Depending on what the cause is, whether it's trauma or non-traumatic, usually they request for an X-ray of the back. They can also request for a computed axial tomographic scan of the back. They can also request for a magnetic resonance imaging of the back. And so these are like, imaging of the back that help give information of the part of the back involved and the structural changes that may have occurred, which it is causing the patient that pain. But then, of course, there are other investigations that they would also request for to help in the treatment of that person. So basically, this is what the specialist would do. And then the treatment for back pain can either be non-operative or operative care. Non-operative care simply involves the use of analgesics, that is painkillers. And of course, the World Health Organization have a step ladder for use of painkillers, whether it's a mild, moderate, or severe pain. For the mild pain, we start with the common analgesics like paracetamol, and then as we then get to moderate pain, we start using drugs like maybe diclofenac, which is of course a non-steroidal anti-inflammatory drugs. And then as we progress to severe pain, the doctor would then progress to the use of opioids like morphine, okay, or codeine to control the pain. But if there is an indication for surgical intervention, like I mentioned, those red flags, after doctor have seen, have examined, and then there's an indication for surgery, then this doctor would have to then operate on the patient. And there are different surgeries that can be done for back pain, depending on what the pathology is. Yes, thank you.
Thank
So
you.
I still want to linger a bit about the causes of back pain. Oftentimes than not, we've heard the issue of obesity contributing to back pain.
Oh, yeah, yes.
What can you say about that? Does obesity really cause back pain?
Excellent question. Thanks a lot. Now, obesity, yes, can cause back pain. And I'm just going to explain to you why that is so. So, the framework for supporting the back is the spine, which is like a stack of bones we call vertebrae. And these vertebrae are connected by intervertebral disc. And then, of course, in the upper back, they're attached to the ribs they're joined to ribs by ligaments. And then as you go down to the lower back, of course, you also have ligaments, but then you have muscles, supporting this framework. Essentially, it is to support the individual, in whatever posture the person assumes, okay, in his or her daily life. Now, when a person is obese, right, there is a lot of weight, put on the muscles and as well as on the spine, because weight distribution is usually along the spine. So when there's a lot of weight, okay, like in obese persons, there is the distribution of weight becomes enormous on the spine, and then the back also does a lot of work trying to support the trunk of this person, when the person assumes a particular posture. So the risk of having a back pain is higher in patients who are obese. So that's why part of the treatment we give to patients who are obese and they have back pain is weight reduction. So they need to reduce weight, because with reduction in weight, that stress, the stress on the bones, the ligaments, the muscles, tend to reduce, and that would help, in the treatment of the back pain of that person. Yes, thank you.
I saw somewhere, is it caudal equina syndrome? I would like to ask, what relationship does it have with back pain?
Yeah, so caudal equina syndrome is an emergency. Okay, so it's one of the cause of back pain. What it means is that okay, let me just help our audience understand. So the spinal cord ends at the level of L1, which is the first lumbar vertebra at the lower border. So beyond that point, all the nerves that need to go down to supply the legs, the pelvic structure, they will need to come down below that level and then exit, through the spaces in the bone, what we call foramina. So as they do so, as they come down there, they form a sheet, like like a bundle of fibers, what we refer to as the horse tail, or the equina, the caudal equina. So it's like the horse tail. So when there is a compression of these nerves or these nerves, then it can lead to caudal equina syndrome. So in caudal equina syndrome, the patient tend to have back pain, but not just back pain. They have loss of sphincteric. They have a sphincteric function. There's loss of the sphincteric function. They can also have weakness in the lower limbs, that's in the legs,
Yeah.
and they can have loss of sensation in the inner part of their thighs. Okay, and when it something in the males, they can also have erectile dysfunction, and when they have this kind of symptom, that's why I mentioned red flag signs. Whenever someone has pain, I notice you have weakness in your legs, you have erectile dysfunction, you have loss of function of your bladder or your rectum,
Yeah.
or even you're feeling numbness in the inner part of the eye, better run to a doctor to see a doctor. So that's what caudal equina syndrome is. And for this kind of patient, they need an emergency surgery to decompress the spine, because usually it's due to a compression. Maybe a disc is compressing the nerve fibers, or something is actually compressing nerve fibers. Without urgent intervention, they're likely going to lose permanent function of the parts involved.
That's
So,
bad.
so that's why it's an emergency condition. So caudal equina syndrome is an emergency. It needs a emergent attention and surgery to decompress. What's compressing the nerve fibers. Yes.
Okay,
Thank you.
thank you.
Okay.
Yeah.
Where I come from, especially as a Yoruba boy, when you wake up with back pain, the first thing that comes to mind is jedi jedi. Hence, they will advise you need to see an agbo seller, a traditional specialist who gives you mixture of grasses, batteries, cook together. You cook it, drink it. After a while, you are okay. So, I can say agbo for jedi jedi is actually good when it comes to this issue of back pain. What do you advise as a consultant? Huh?
Well, thank you for that important question. Okay, I would say that herbs really have a combination of different agents, and over time people have noticed that when they use it, it gives some relief. The truth is that they may have some active ingredients in those herbs that of course have analgesic properties. However, it's not advisable to use them because those are unpurified agents, if I put it that way. You're using unpurified substances for the treatment of pain. So that's one reason. The other reason is that there are a lot of causes of back pain. So if you are just treating the symptom, the back pain will not go away except the root cause of the symptom is addressed. And that is why you have to see a doctor who will then see you, listen to you, examine you, and then investigate you in order to decide what is the cause of this back pain the person has, and where exactly is the cause, so that treatment is then targeted. So but when people use things like agbo, like you mentioned, they are just trying to treat the symptom, and those substances are not purified. They can even cause more harm to the body, because if you take those substances, the body would have to look for a way to get rid of them. And of course the kidneys is one of the substances. The kidney is one of the organs, and even the liver these are the organs that would help detoxify the body of those substances. So it's better that we use purified agents like we have in drugs. We know these drugs, they are purified. We know their chemical formulae. We know their mechanism of action. We know their adverse effects. We understand them, so we can use them, and they have been documented to be efficacious, and also to produce good outcomes. So we know these drugs, and that's why we subscribe to them. But beyond that, it's not just to treat the symptom, it's to treat the cause of the problem. That is why I said you have to see a medical doctor. And if you then notice those red flag signs I mentioned, please just go and see a specialist, a medical doctor, more important, a specialist. And don't keep saying you are using agbo, because you would only be making the problem worse for yourself. Because as you keep using the medication and the problem is there, not solved, okay, over time you discover that it will cause permanent disability.
Exactly.
No.
It cures anything, everything, in fact.
No, that you are just assuming that something, you use something and it works, doesn't mean that it is actually the right treatment. So whenever you have
two persons supporting Agbo really shows it works.
It doesn't mean, even if you are 1 million, it doesn't mean what you're saying is right. If someone has back pain, the person needs to see a medical
No, I
doctor.
don't believe. My mom
Because
suffered from chronic back pain at a point in time.
Sir, you need to, because we need to understand what the cause of the back
All
pain
she needed to do was to see a traditional specialist who put grasses back of tree, which we cut by
These
ourselves.
are herbs.
Sir,
They're very medicinal.
No, well, medicinal, that's what they made you believe, right? I'm not trying to, say that people don't use these things and sometimes they'll work for them. But that doesn't mean that it has addressed the cause of their pain. And that's what we're talking about.
But
that
for years, it hasn't returned.
It's not that people use that, but people also massage the neck and massage the back and think that by doing that, they get relief. Those things can even, worsen their condition. So that's why we advise that they go see a doctor, for their treatment.
Me too.
When should someone with a back pain be worried? Is it immediately you wake up and you discover one part of your back is paining you? Does the person need to worry immediately and rush to see a consultant, as you've advised a neurosurgeon or a neurologist, or you have to wait for certain days for the same signs and symptoms before you run to see a doctor?
All right, thanks for that question. So, what we notice, basically from my experience, is that when people have back pain, they don't usually go to see a medical doctor, a specialist or a non-specialist. They would use the over-the-counter medications, use medication. Now, it is when that medications, medication have failed to relieve them of their symptoms that they then seek for the care of the attention of a medical doctor, to then see them and evaluate them. But the appropriate thing to do is that when you notice pain that is out of normal, out of normal, I'm referring to, pain that is unusual. Because sometimes people have, pain after, like I said, postural, they sit for a while. By the time they leave that position, that posture, after some hours or minutes, they get better. The pain relieves. So they're not worried. But when a person is having pain that's lasting not just for several hours, lasting for days, you need to see a medical doctor, a specialist, more importantly. But it's not about whether it even lasts for several days. Sometimes a person has pain and then it's not just that the person has pain. The person then has other things, like I mentioned, like weakness. You notice that you're getting weak in your leg, or you notice that you can't, walk, or you can't urinate, okay, or you are feeling somehow on the floor. Below your feet, or even you're having numbness, in between your thighs. Those are red flags. So you don't need to wait. Once you notice them, okay, please go and see a medical doctor. And that medical doctor, if it's not a specialist, would investigate you and refer you to a specialist who would then treat you. But if you have access to a specialist, it's better to go see a specialist immediately. And by specialist, I mean a neurosurgeon or a neurologist. So you don't need to wait, okay, for several days before you go see a doctor. And like I also said, that sometimes the pain may actually be mild and may be due to posture. And by the time that posture, you stop assuming that posture, the pain resolves. So sometimes people don't get to see a doctor for that kind of pain. Yes, but the ones I've mentioned earlier, they're very important. You need to see a doctor, a specialist, more importantly. Thank you.
Help me clarify this. There was one time I was having a severe, anyways, I don't know if it was severe or moderate. I was having a very terrible back pain.
Okay.
And I decided to, rest a bit. And then when I woke up, guess what? It was as if it got worse.
Worse?
Yes. Although I was sleeping for a long time. And when I got up, I thought, it would go away. But it was still there. Like, it was getting worse. So what would have happened?
Well, my guess would be that, you'd assume the posture that, kind of made the pain worse. Okay, but because if you think back clearly, you would see that after maybe a few hours or maybe a few days, the pain disappeared, or maybe you used the medication, the pain then disappeared and didn't show up again. Yeah, so it may likely be that it was as a result of posture, because like I said earlier, this abnormal posture, they put the muscles into strain, and then of course that was consequently lead to pain.
But I was lying down comfortably.
So that's the same. So the same thing we said earlier. People lie down comfortably, but they're lying on the wrong material.
Could you please advise some of the best sleeping positions, just to back up our question? Best sleeping positions.
Okay. Yeah. So okay. All right. Now, so so when people sleep on the left lateral, the right lateral position, it tends to give a lot of relief, and it doesn't really put the back in under any form of strain, and so they are unlikely to have pain. When I mean left lateral, I mean you're sleeping on your side.
Okay.
Do you understand? Yes. When you sleep on your side, it's better than, of course, when you are either sleeping on your belly, that's your sleeping face down, or your sleeping facing up. Okay. So those are different sleeping positions, but of course, I'm saying that the sleeping on the side, which is a left lateral, right lateral position, it's better when compared to those other positions, because the risk or the chances that they'll put you back under strain is less, or should I say is less compared to the other sleeping positions. So you're likely to have back pain from that kind of sleeping posture.
So let's look at some myths, or what I call myths, misconceptions, or facts about back pain.
Okay.
I would like to dabble into the female world a bit.
Oh, okay.
Females of nowadays, they like using girdles, waist trainers. When they sew their clothes, especially for the Owambe parties, you see them strapping themselves to bring out all the bombs and the likes.
Okay.
Now, does this in any way contribute to back pain, or can this affect their back in any way?
Well, I'm not sure that using a waist trainer or girdle would worsen back pain. If anything, it actually tend to strap, or should I say splint the back. Okay, so that splint means providing some kind of support. Okay, so using a waist trainer does not or has not been known to cause back pain.
Even when it affects their walking posture. You need to see these ladies when they walk with girdles.
It's unlikely that the use of a waist trainer or or kind of a lumbar support will lead to alter the movement of the person is unlikely. Yeah, so I'm not aware that there's any reports of that causing back pain. Yeah.
So simply put, our women should continue using it.
Well, well, scientifically, it's not been proven to cause back pain. So okay. I can't make comments that it causes back pain. That's what I'm trying to say. Okay. All right. Thank you.
Okay. So could you tell us some few tips to prevent back pain?
Oh, thank you so much. Yeah, to prevent back pain, one of the things one needs to do is to always attempt to assume an optimal posture, like a good posture. When you're sitting, okay,
it's a good posture.
Yeah, so when you're sitting, like you're sitting now, you need to get your back relaxed. Don't put your back in any form of strain, like sitting like this, where especially when there's nothing to support you. You are just bending like that, okay? That's going to strain your back. So assume a good posture when you're sitting, when you're standing. Sometimes you see people who walk and they move their body a particular way, or they are it's not only even when they're walking. We talked about sleeping, okay? Even when they are walking on the computer, people just act their back forward, so all those are not good postures. So you should always assume a good posture. Sit and be relaxed. When you walk straight, chest out, okay? And then when you are sleeping, we've talked about sleeping. So assume a good posture. That's one of the first things, you should learn how to do. That will reduce the risk of back pain. The other thing is to avoid putting unnecessary strain on your back, like lifting heavy objects. We know there are some people involved in that kind of like weightlifters, but if you notice, this weightlifter, they have professional trainers that give them, like what you mentioned earlier, the pelvic strap or girdle to splint or support their back and of course they also receive treatment after those trainers exercise. But it's not advisable for people to do a lot of weightlifting, especially when you're not trained to do so, because you put a lot of strain in your back and that can cause back pain. Another thing one needs to do to reduce back pain is weight reduction. If the person is on the big side, we advise that the person should reduce weight, because like I said earlier, having so much weight can put stress on the spine and the muscles of the back, and then that can also cause back pain. So basically these are some of the tips that one needs to observe, healthy tips that one needs to observe in order to reduce the risk of having back pain. Thank you.
Okay, moving on to the next question. You've talked about what someone needs to do if you notice any pain.
Yes.
Run to see a doctor. Most specifically, if you have access to a consultant, be it a neurosurgeon or a neurologist.
Yeah.
Now, someone who has gone to see a doctor or a consultant is being advised to do surgery, especially to reduce the pain on the. So my question is, when exactly, or at what point exactly, does someone require a surgery for back pain? And in your word as a consultant, how often, or you can put it in form of percentage, how often do you see patients who need surgery for their back pains?
Okay, thank you very much for that question. Now, for surgery to be done, on a person who has back pain, there has to be an indication for the surgery. We don't operate on people because they have back pain. There has to be an indication. And like I said earlier, how we then decide whether there's an indication for surgery is that we need to listen to that patient. We need to listen to their story. They need to tell us about the back pain they have. We then need to examine them and then demonstrate that they have physical signs suggestive of of an injury to the cord, that's the spinal cord, or the nerves coming from the spinal cord, like we mentioned earlier. So if it's due to injury to the cord, spinal cord, or the nerves coming out from the spinal cord, either from a compression, or a compression basically, either from a fracture or a collection, within the canal. If we then decide that this is the problem, then we have established an indication for the surgery. We would then, of course, to do that, we have to also do imaging, like I mentioned, CT scan or an MRI, of that part of the body. Of course, we'll do that, and then we'll now establish the problem, that is the cause of the problem. Then we'll then discuss with the patient, about our findings. And our intended option for care. Of course, in that case, it will be surgery. So we'll take the patient through the in summary, what we want to do for the patient, to relieve the back pain. What are we expect, to be the outcome, and what the patient would then be doing thereafter after the surgery. So basically that's it. So we see a lot of patients with back pain, okay, but most times, like I said, before patient comes to you, especially in Nigeria, before the patient comes to you back pain, just know that patient has been suffering from that back pain for a long time. And of course, in my practice, I've seen a lot. More than 1,000 is actually a small figure. More than 1,500 or even 2,000. Trying to be modest, really, of patients who have back pain. Now, in all that number, let's say about half of them, or less than half has merited surgery, and they've then had surgery. Okay. So in summary, I'm trying to say that the patient has back pain does not mean the patient will need surgery. So you need to establish that there is an indication, a need for the surgery before the patient can, and you discuss that with the patient gives consent before you can go ahead with the surgery. Yeah, thank you.
We've been talking about surgery. So after a spinal surgery, it is encouraged for the patient to move around, right?
Oh, yeah, so it depends on the type of spinal surgery we have done.
Okay.
So if the patient has done a spinal surgery in which we have also fixed the spine, because sometimes we do spinal surgery and also fix the spine. The patient can have early ambulation because the spine has been fixed.
Okay.
So, but when we do a surgery and patient had not, we didn't fix the spine for a particular reason, of course we can allow the patient to have some rest. We would also we encourage early ambulation though, but it may not be as early as when we fix the spine.
Okay.
Yeah, would need the patient to have healing would have started. The patient will have some analgesics. Then we'll start ambulation gradually.
Gradually.
Yes, and then
Right.
patient then progresses with walking.
Thank you.
Yeah, welcome.
So the next question, sir, in this side of the world, a whole lot of people, they're always afraid when it comes to surgeries. The first thing that comes to mind when it comes to surgery is, I might not come out of this surgery. So what happens in the case whereby someone has been said to need surgery for back pain? What's the success rate of patients who come in presented with back pain and the likes?
Yeah, thanks a lot for that question. So, it's one thing we've achieved, especially in the science world, is improvements in healthcare delivery. So there's been a lot of improvement in surgical techniques and also treatment of back pain. Now, I want to state here clearly, okay, that in Nigeria, especially in the hospital where I work, in Duke's Neurosurgery and Specialist Hospital, we have world-class facilities and we have the technical know-how to address patients, to address patients or to treat patients who have back pain. So people should not be afraid of surgical intervention. Whether it is, oh, I won't make it, what then happens if surgery is done, my condition can get worse and everything. So I want to just debunk that. I'm not trying to say that their fears are not real. Their fears are real. However, I want people to understand that we now have better facilities that help us prevent those kind of things. And one of them is the use of an instrument, we call them operating microscope, as well as what you call cavitron ultrasonic aspirator, for patients who have lesions that require the use of that kind of equipment. And then not only that, there's what you call intraoperative neurophysiologic monitoring. These are state-of-the-art facilities that help us monitor the patient. Apart from the anesthesia, specialized anesthesia, which is what we call neuro anesthesia, that we use for those kind of patients. This equipment help us monitor the patient, operate on the patient, and then as we are operating, we'll be monitoring to know when something is wrong. Okay, so because we have access to this state-of-the-art facility, we're able to detect early when something wants to go wrong, and we prevent it, we stop it. And so our patients who've operated, they don't have worsening of the symptoms. If anything, they get better, right? So I want to debunk that fallacy that patients patients don't make it or they get worse after surgery. No, that's a fallacy, right? And there's this thing people say about 50-50.
The chances of survival 50-50.
50-50. There's nothing like 50-50, okay? Yeah, so surgery is safe, and it also gives a satisfactory outcome. We understand that, of course, there could be adverse reaction or adverse events or should I say, there could be complications, right? There are documented complications, relating to surgery, whether it is a surgical procedure or after surgery. However, all these things, the reason why they've been documented is for people to understand, to know how to prevent them. And, we've come to the point where we understand these things clearly, we know how to prevent them, and we put all our resources together, with both technical resources and as well as, state of the art facilities to help us prevent these problems, and give patients, excellent and world class care. Thank you.
You made mention about using opioids like codeine,
Yeah, morphine. Yeah.
to manage pain depending on the level.
Yeah.
So I'd want to know if there are any implications of this opioid, because I know that there are strong opioids. So are there any side effects or complications, especially for those that are usually, although I'm not encouraging self-medication or administration, but there are some that would rather take painkillers on their cells than coming to the hospital. So are there any side complications?
Yes. Thank you so much for that question. So opioids are controlled drugs. When I mean controlled drugs, that no pharmacist, no trained pharmacist would give you opioids without a doctor's prescription. Okay, and so you can't even buy the drug on your own. You need a doctor's prescription.
Okay.
Yes. So the problem is that opioids, there are problems with opioids, and one of the problems, or should I say, adverse effects of opioids is that they can cause addiction. People get addicted to it,
Yeah.
because of the relief they get almost immediately after they take it. So it makes them feel good, feel better. So they're likely to get addicted to it. So we don't want that. So that's why it's controlled. The other thing, with the opioid, especially a drug like morphine, or even tramadol that people use, is that codeine that people use. These drugs can also affect bowel movement. Sometimes people they have constipation. So if a doctor is prescribing an opioid for you, the doctor is likely going to also prescribe a laxative, just to make sure you don't have constipation. But more importantly, the addiction. We don't want that. So that's why it's a controlled drug, and a doctor has to be the one to prescribe it before you can use it. Yes.
All right. Thank you.
You're welcome.
What do you think are some public health interventions that can reduce the global burden of back pain in the future?
Oh yeah. So thank you so much for that question. So what we are actually doing now is one of the public interventions. It's called raising awareness. So we're raising awareness about back pain. What people need to know about pain and what they need to do. Okay. So raising awareness about back pain is one of the steps that needs to be taken. The other thing that needs to be done is policies. Formulation of appropriate policies, and that is at the government level. So the government needs to promulgate policies that would help improve healthcare services in the country, especially at the primary health facility level, where people can quickly go and get healthcare. And then in investigations, in fact, most hospitals in the country don't have magnetic resonance imaging, as well as computerized X-ray tomography machines, which are specialized machines that help us in the investigation of people who have back pain. So these are where the government come in. They will help hospitals, get this equipment, which will then go a long way in treating people who have back pain. But of course, these are public interventions, raising awareness, health policies. Another public intervention that could be done is what we call the National Health Insurance Scheme. A lot of people have back pain. They want to go to the hospital, but because they don't have money, they are discouraged. So if the government also step into this place and expand the health insurance scheme, ensure that it covers for all types of conditions, people will be encouraged into use that scheme. And also, if there's a compulsory registration of citizens in the country on that scheme, the government makes it in such a way that people are registered in that scheme, whether, because I know that most people that are employed are people who are registered in that kind of schemes. Other people who are either self-employed or not employed are not. So if it's done in such a way that everybody is registered, in that scheme, they'll be encouraged to use health facilities, for their care. So those are some of the public intervention I think that can help address this issue. Thank you very much.
All right, thank you, Dr. Ifeanyi, for such a nice conversation, for giving us a broad insight
You're
on
welcome.
this topic. It was nice having you.
Thanks a lot. Thank you very much.
So that's it on the second episode of Health Conversations based on the topic back pain.
Once again, we'll say a very big thank you, Dr. Ifeanyi. I thought I knew better about back pain, not until you've expatiated and talked more about it. Thank you very much. And we wish you the
You're
best
welcome.
in especially your medical field.
Thank you very much.
Thank you very much. It's a wrap on Health Conversation with Dukes. Please subscribe to our YouTube page. Click, like, share for more people to learn and also know more about what we're discussing. The reason why we are here is because of you. See you on another beautiful edition again. We love you and we'll see.